baseline definition of an arrhythmia is anything out of the normal sequence in a heart rhythm. So it can range from a skip beat all the way to a completely abnormal, disorganized rhythm. So the most common rhythm is in the top part of the heart, the atria. The rhythm is called atrial fibrillation. The origin of AFib comes from specific veins that plug into the heart. And we could prevent those abnormal signals from escaping the veins, that we would have a better outcome with the AFib. And what we've learned over the years is that the treatment of AFib is better the earlier you do it. As soon as AFib is diagnosed, the best treatment with the best long-term outcomes is to go for the ablation. That's the number one therapy now. So this is much different than the concept of 10, 15 years ago, where you would try observation, medication, wait to see how it goes, and then the ablation was sort of thought of toward the end of the options. Now, the current thinking is to get to the ablation the first sign of AFib. And for years we've been trying to perfect ablation for atrial fibrillation, but the newest modality is called pulse field ablation. It's a more targeted and effective ablation that is specifically directed at the cardiac cells. What pulse field ablation has done is eliminated the complications of radiofrequency, because they are so targeted that it leaves alone the esophageal tissue or the nerve tissue, so that those complications reportedly don't occur.